everyone. Uh, it is a pleasure for me to be here with all of you, and this is one of the I think mammoth tasks which we all have done. So, would like to congratulate all the stakeholders, Seven Alliance, Global Fund, for their constant inputs, and also our communities in the South Asia Pacific region. I think this is a great learning for all of us, and I'm quickly going to share the briefings, which is again a task for me because summing up everything in 20 minutes is difficult, but we'll try to cover it up. So basically, when we started it last year, as mentioned by Harry, so the whole idea of the assessment was to kind of understand, access, the level of community specific to capacity building knowledge in terms of, technical understanding of the global fund procedures, processes, and mechanism. And on the basis of it, also identify what are the emerging challenges which communities are facing, on the basis of which to develop a strategic plan for Seven Alliance Consortium, so that the Learning Hub will implement the program and will actually cover all those inputs which are provided by the community. So itself is a great opportunity where we all have given our inputs, and thank you to all of you for this, wonderful inputs or insight which you have provided. I'm trying to kind of move it. It's not moving, sorry. Yeah. Next slide, please. So we started it across the Asia Pacific region, and we covered approximately 17 countries. And it is a mix of kind of a desk review and the in-depth interviews. There is a FGTs. There are like key informant interviews. And if you see on this slide, so representation wise, I think that Nepal has lead because from Nepal, we have maximum participation. And we also cover the very, island countries, oceanic countries like PNG, etc. And overall, Monkey Survey has 97 responses. We got a great idea inputs and FGDs and K informant interviews. If we see the circle here, the pie chart, so HIV constituency has a larger representation, followed by TB and malaria. Next, please. If we look into the demographic profile of the communities, so here you see that approximately there are like 50, we made sure that each and every community is being represented. So number of men, number of women, and trans women, non-binary people were part of it. And also the every sample we took very carefully that each and every community should be represented well. So the people who are living, who use drugs are represented, men who have sex with men, the transgender women, transgender men were also interestingly part of the survey. Then sex workers and others. Now, others is a community because we deal with 3 disease areas: HIV, TB, and malaria. So largely, other are the people who come from the general community who are part of the either TB or malaria disease group. Stakeholder wise, we went to cover the entire thing. It is like started with the CBO representatives, then CSO representatives, and the national network we have covered, and also the CBO representatives. So a very complete and a comprehensive plan was developed so that each and everyone should be included. And also a special care was taken that the survey or the assessment should not be only limited to metro cities, the bigger cities, the capital cities, but should also extend to the far off cities, the smaller cities, because we need to have the voices from every corner of the part of the region which we are covering in. Next slide, please. So here is the distribution of the population. You see that largely, as we said, that it has come from HIV constituency, where we have a representation of people who are living with HIV and AIDS, and then key population largely participated, and there's a small number of young population is also included. Similarly, in case of TB, women, very, very prominent group, and we have seen that, women participation is always kind of a challenge when we talk about, but we made sure that, we should hear what women want, and women who are vulnerable, who are at risk. Similarly, in case of malaria, which is actually a tough terrain for us, because there were forest workers, there were indigenous population, there's a migrant population within the subsect of malaria were also being covered. Next, please. So the entire assessment was actually based on few parameters. We try to understand that what is the responsiveness from each of these three constituencies and the communities in terms of the national strategic plan, number one. Here you can see the graph on the top. Overall, largely, we can say that more than 50% of people were kind of satisfied. And I think more than like 70-80% of people participated in the NSP. Then about the global fund engagement. Now, global fund engagement has two components. One is, when any grant comes in. So when any grant comes into the country or the grant cycle starts, there is a time when communities come together. There are discussions happen. There are dialogues which are happening. So one is that part, and second part is actually community engagement into actual grant writing process. So here you can see that, yeah, we have a fairly good representation of communities. It is greater in terms of, community country level dialogue, and slightly lesser, but not is still great, in terms of grant writing process. Here further, the equal representation of CCM, which is also one of the strong structures of Global Fund, which provides an opportunity for communities to kind of come and participate in an equal manner. So here we try to understand that whether the CCMs are dominated by a particular group, whether it's like very men dominated, or what is the status of other key populations. So here from range 0 to 5, you can see that women groups are there. They're having only half a representation. Indigenous women groups, especially when we talk about malaria community, their representation is very, very limited. Same in case of transgender women, we can say it has a very good representation. And interestingly, the women who are living with HIV have the largest representation among all the groups. Next, please. Now, what are the barriers which we try to understand? Because the previous slide gives you a very, very overall picture. But when we segregated it, when we deep down into different groups, so over there we found that young population, they approximately 46% have mentioned that their engagement into all these structures, whether it's CCM, whether it's grant writing process or global fund mechanism or NSP, that is they felt that it is not that engaging. They need to have a more deeper engagement. Similarly, women groups have also highlighted that approximately 30% of women, highlighted that, yeah, it is there, but yet need to strengthen. Interestingly, the drug user community, because we are from Asia Pacific region, and most of our countries have the criminal laws. Now, it also varies from country to country. We had countries like Philippines, if I name, which has a very, very strict laws. So where the representation of communities into the system is also kind of, is restricted because of these, legal challenges. But the drug user community overall have mentioned that they felt that their representation is limited as compared to other groups. Although approximately 30% group has said that they did not face any disparity. Now, in terms of when we ask what are the challenges, so low engagement with the government is one challenge which has been mentioned. The one which we have mentioned is, equal representation in CCM. Then we talk about the semi-rural and urban population. So there is a greater need to engage, because 35% people have mentioned that they are not being part of any of the national level meeting which are happening. Digital literacy is another challenge. In general, on the right hand side, you can see that some people felt it's tokenistic, it's equal representation need to be there, lack of a meaningful engagement. Again, kind of then limiting. Very important is the limited influence on decision making. Although people were there, but there's not a strong kind of decision making power which lies with them. Next, please. Now, this is about another challenge, which is about safety and security. It is with the key population and vulnerable groups. So here we see that stigma and discrimination is happening, lack of legal protection. Again, group to group, it rises. For example, in India, there is a legal protection, but when we talk about within India, the drug user community, they don't have protection. So likewise, it differs from different to different country, like Philippines, for example. So inadequate access to safer spaces is a challenge, and physical violence is still a challenge when your gender is extremely kind of, visible, especially by the transgender community. We also talk about the climate change because it's impacting the overall kind of, the communities. Uh, because of climate change, people mention that there is a homelessness, there is displacement risk with them, and a loss of livelihood, which is a challenge. And what impact all these three things would put on your health, which is physical, mental, and social. So here, kind of people have mentioned that there is a restricted or low engagement, in emergency services. People have also mentioned there is a disparity in terms of, giving the relief services to the people. Next, please. Now, what learning needs we have identified is number one, that in terms of, country level dialogue engagement, we need to kind of, have a detailed manual. Detailed manuals are there. We need to kind of, provide a capacity building to the communities. We need to ensure that there is an enhanced participation in the CCM, which should have equal representation. Then building capacities on evidence generation, because that is, I think, something which is very important when we bring any case to the, in front of Global Fund or during the grant writing procedure. Capacity building in terms of funding request is also one of the very prominent areas which has come up. Similarly, in case of grant making, it's more or less same, but people, there is a strong demand that we need to understand the overall kind of grant writing process. Reprogramming is a very, very important and a critical issue, and communities have put forth that approximately, I think, 58%, like 60% people mentioned that we need to really understand how it's being done so that we can effectively get engaged into the system. Next, please. Uh, then CLM learning needs are definitely, we need to develop the strategies on community engagement, so that, communities from three areas should be engaged, equal representation should be there. Then capacity building on human right aspect and capacity building on global fund intervention, we need to give it to the member who are part of the CLM. Then in terms of learning need, equal representation, we see that these are like some of the responses. I'm quickly kind of skipping in the paucity of the time, but very important is that equal representation is something which has come up very, very strongly from the participants. Next, please. Then learning needs in terms of, integrating climate change concerns. So here we need to, first of all, understand that we need to have the, we need to generate the evidences. We need to understand that how information, more information, that how, climate change is impacting the communities. We need to have a system where we can, generate more evidences, so that in the future or upcoming grants we can highlight these issues. In terms of community preparedness, because COVID-19 has also, recently we have seen that it has created a havoc within the communities. So over there also, the community preparedness communities have felt that we need to work on it. We need to have a pandemic response activities, community engagement strategies in place. A mental health support is very critical, because people have often said that it's more program, but the mental health aspect is kind of missing. More IEC material, more risk mitigation, risk assessment kind of strategies. People have highlighted that it needs to be there in the program. Next, please. Now, safety and security, which is our last point, which we have wanted to highlight, is so here I think people said that they need to have the capacity building on legal awareness and literacy, which we could talk about, and capacity development on safety and security fundamentals, and also the best practices which are happening across the region, because some region might have a kind of crisis response mechanism or teams, how we can kind of so a cross learning is also important, which is highlighted by most of the respondents. Next, please. Now, preferred mode of technical assistance for the capacity building. So it has two components. So people highlighted that it has to come through, emails, and the newsletter should be there. And approximately very less number of people said that through kind of telephone, but yeah, largely through email. If information comes about any upcoming capacity building, that is going to be very, very useful. Now, the preferred mode which people have mentioned, our participants, is webinar and training session in physical space. Then there are peer learning or exchange program, which approximately, again, both are like 80 to 70% people have highlighted. Now, one-to-one mentorship and coaching is another area which most of the participants, like half of the participants, have mentioned. Then having the resource material, the tool kits, and which will be very useful for dissemination of the capacity development sessions. Now, the preferred mode here is, again, like workshops are there, and then it's the same thing. We can skip it. Now, what are the key priorities? I think it's 5 minutes left, and we have to quickly sum up. And what are the key priority areas which are with the 7NS Learning Hub here? Number one is to address the limited community engagement. We need to kind of go with the enhanced understanding of the. We need to develop the sessions which will enhance the understanding of global fund processes and cycles among the communities, build capacities on new age in intervention tools like PrEP, self-testing, because these things are coming, and advocacy for its inclusion into the national strategic plan is very important. Enhancing the community-led monitoring, which is definitely one of the opportunity for all of us here. Now, in terms of disparity and limited decision-making influence in CCM. Again, a highlighted point here. So capacity building on global fund mechanisms of the CCM members, because you provide them, it will capacitate them to kind of understand, and also kind of building the negotiation skills, because over there things happen only through the negotiation. So that whole negotiation power is something which we need to kind of really, build capacities on. Increase awareness, on a specific, disease areas, because within this HIV community is still prominently kind of, taking up the thing as compared to malaria and TB community, where we need to invest more capacity building. Then facilitate community, collectivization, preparedness, having a specific IC material, and building the champions within the 3 disease constituency areas, especially focused on TB and malaria constituency. Next, please. Now, in terms of climate change, which is a major challenge, and very less people are talking about it. When we, in fact, ask the communities, there was also very less understanding about the climate change and how it impacts your health, overall, or what kind of impact it might have on us. So here, the inclusion of climate change and its impact on communities in existing global fund grants, not only global fund, but any grant we are writing, we need to have it, because we are representing the global south. Our countries are the most affected, by the climate change. There are a lot of cyclones, a lot of kind of flash floods are coming. So this is something which we need to kind of, rigorously put in each and every existing grant. Then develop awareness and adaptation strategies on the climate change and its impact on the health, and how we can kind of mitigate it. Now, very important is access to health in global fund interventions. Again, health is a right, and human right, both are kind of linked. How we can kind of, build the capacities of the community, where we successfully integrate the health and human right into the existing programs. Now, inclusion of safety and security concerns, because in our region, most of many parts, like for example, from Pakistan, from many other countries like Bangladesh, we got a very disturbing stories. So I think here we need to build capacities of the communities on the legal literacy. What are the legal things with them, how they can kind of use what are the existing laws, is providing them the support. Then capacity building on the safety protocols, which is very important, and the technical support on strengthening the crisis management mechanisms. And I said earlier that cross learning would be very useful. Here, moving to the next slide, that how this thing will be disseminated. So here, only we highlighted like few areas. It's the same repetition. I'll just quickly go through. So for community member and leaders, we need to have a capacity building on developing the funding, on funding request development. Then again, for the grant writing process, we need to kind of provide the template for proposal for, for the community so that they are kind of, capacitated on that. And grant negotiation, we said, very important part. I think the last point is going to be extremely important now. If I have to rate, I will give it priority number one, because sustainability of CBOs and community initiatives. We need to see how we can ensure the sustainable funding for our communities, and access to donors and access to professional consultant, which can be facilitated through the learning hub, which will be very useful for the communities. Next, please. This is, I think, last slide. So what are the preferred modes here for the dissemination? Because we are a very diverse area. We are distributed in like rural areas, in a limited internet connectivity, or in the urban city. So e-learning is something which can be kind of taken up, considering today's scenario. E-learning capacity building sessions can be done, then modules and manuals which are kind of translated into your local language, because as a region we have a very diverse diversity among each other, and we have a lot of languages. If those can be done, and here a very strong component has come up, that not only something which is written, but if something which is pictorial, or some sort of a video, and some sort of which can be used in providing kind of or capacitating the community and raising the awareness. Then social media creative is another area which it has been talked about. A constant webinar, as we are having it now, and thank you for having all these webinars, which are kind of very, very, very useful. Then creating the digital content, we have already covered. Email and WhatsApp are the preferred mode for the dissemination of the capacity building or the awareness material, are mostly talked about the communities. Next, I think we're coming to end with this. I'm able to complete in 22 minutes, but yeah, a lot more is there. I'm more than happy to answer it. The report is already on the website. You can check it, and I hope we have time to kind of discuss this as well. So over to you, and thank you very much.
Thank you so much, Yasminder, for the comprehensive information. Considering the time limitation, now we will have to move on to our next session, that is panel discussion. Please park your reflection and comments for now. We will take it during our Q&A session. So before moving to next session, I would like to request everyone to open your camera to take the picture. Could you please help me to take the picture of everyone? Thank you.
We have multiple screens, so I'll just repeat smile and change the screen. I'm not hoping who is first, I'm not sure who is first, who is second. So please keep smiling till the time I finish all the windows. Number 1, 2, and the last one. Yeah, thank you so much.
Thank you so much, Chinmay, for this. So for the next session, I would like to invite Ika Novianti, Regional Coordinator at Youth Lead, to moderate the same. Ika, the floor is yours.
Thank you so much, Karan. Hi, everyone. Good morning, afternoon. As Karan mentioned, my name is Ika, Regional Coordinator of Youth Lead, and now I will be moderating the next session, which is the panel discussion. Thank you so much, Lisa, for the comprehensive presentation on the survey result. And for this panel discussion, we have 3 community experts joining with us. The first one, I would like to invite Usman Malik. He's the representing HIV community member from Pakistan. Usman is a development professional currently working as the executive director at Daricha Male Health Society, a community-based organization since 2015. The next panelist, we have Chamrun, is currently the co-chair of API and the executive director of KANA in Cambodia. Chamrun is an advocate and activist for HIV, TB, and other health issues. And last but not least, we have Sri. a public health professional with more than 10 years of experience in public health program planning and implementation, focusing on infectious disease and migrant health. So, Usman, the first question I will direct it to you. So, do you think the report reflect community needs or gaps on the ground? And what do you think should be our three top priorities as per the report share? Yeah, over to you, Usman.
Thank you so much, Eka. Thank you so much. Yes, I would like to proceed with to answer the question and the suggestions onto those. Recommendations. So I have gone through the report, and which is very well articulated. That was a very I would say a lengthy process to go through a questionnaire and then IDIs or FGDs and everything. So it's not a easy task to articulate a report which is based on the whole Southeast Asia, a lot of countries. So if I do have a lot of comments regarding the report. When we see, if I talk about the circumstances of Pakistan, so when we see the report, so when you see a lot of other countries like Nepal, Bangladesh, India, Sri Lanka, but you cannot see the name of Pakistan in two major circumstances like tuberculosis and malaria. There is a reason for that. There is a reason for that. We do have names, we do have the representation in CSC, CCM, and everywhere of communities when we talk about the HIV sector. But if we talk about the tuberculosis and malaria, yes, their mandate is quite different, and they are specifically for the tuberculosis and malaria affected people. So the community representation is not there. Yes, that's true. And for this, I would say that, and the first suggestion I would say, the integration is very much important of these programs, as Yashvinder had mentioned as well. So integration is very much important along with the HIV, because it's been ages the communities have been asking the CCM forums and other PRs to integrate the systems for the better future of the communities. So that was the basically first point and the suggestion. Secondly, though the KB representation in the HIV sector, if we talk about, so the KB representation is there. Till the last year, there was only for the transgender person, but now it's for the MSM and the for female sex workers as well. Soon it will be announced, and there will be the elections for all the representatives. But again, though the representation is there, but I don't know how and why there is no involvement of the communities. No, there is no community engagement in the policy making, and there is no engagement of the communities in any budget planning or implementation plan for the communities. Communities should know what is going to happen on behalf of the community. So the communities are somehow lacking here, just because every time they wanted to speak, they wanted to say something for their better future, which is impacting the whole grassroots community. But this is basically a dilemma. There has been no involvement of the communities in most of the policy making. So here I would say, I would suggest a second scenario. Global fund should uh, we need to see the gap. Where is the gap? There is a communication gap between the global fund and the communities. So there are the bridges, but I think those bridges are not enough. We need to communicate with the communities and the global fund directly. So that's the only reason. That's the only way we can get rid of a lot of issues which are going on with the communities in Pakistan. um, Except to that, there is whenever there is no community strong voices. I mean, community voices are there, but definitely how we are derailing all that initiatives and movements. Most of the things, most of the community-based organization initiatives and community-based organizations are going to be awarded by the CCM to the non-community factors, and the result of those decisions are like disastrous. Definitely, if a non-community member is implementing something for the community, so I mean, how they will be doing something on the betterment of the communities, since they don't know anything about the dynamics of the communities. So I mean, we need to look here as well. We are looking at the global fund. People are looking, communities on the grassroots level are looking on the global fund. I mean, you should communicate with the community. The gap should be, covered. So, except to that, I mean, though all the most of the problems are there in the HIV sector since years. I mean, I'm here in this sector since last more than 10 years now. So I'm just looking at the problems and the comments and different other things. I used to talk a lot of things regarding the advocacy thing. So I mean, if something is going to happen among the seven alliances, so I mean, why not the Pakistan? So I mean, there's a need of a strong advocacy tools initiatives, as advocacy initiatives are going to be implemented in the, other Asian countries. So Pakistan should be included in that among seven alliances. So why not? It's the eighth alliance. So I mean, it will be fruitful for the communities in Pakistan on the grassroots level. So I mean, that's the only way I would say that the people of the Pakistan, the communities of Pakistan, can overcome their problems. So I mean, on behalf of the communities, I would say, I would suggest, I would request that the it should Pakistan should be included in such manner. Except to that, Yashwinder was talking about the CLM. So I mean, hats off to the APL-HIV Pakistan. I mean, they have started the CLM initiative since ages for the treatment component, and now it's been third and fourth year. We have started this initiative. Uh, uh, for the prevention component, and now we are moving on. We are increasing our cities, and definitely we are moving on and on. I'm a part of like this task team member, so that CLM task team. So I mean, I would say that there is a need to include Pakistan in all those initiatives and preferences, so that Pakistan can move along with other Asian tigers, so that Pakistan, I mean, there's a need to do a lot of work for the communities in Pakistan. I am here since more than 10 years, and I am like listening and seeing such kind of situations. So I'm literally, most of the community members, the activists are tired now because they're raising their voices, but nobody is listening. Somehow they're listening, but not in a way that it should happen according to the community dynamics in Pakistan. So I mean, I would really like to thank the whole effort, the whole. I mean, the study have been done. So I mean, the voices have been generated from the grassroots, not only from me, from a lot of other community members in Pakistan. So they have tried to raise their voice in a way so they can say something, they can do something for the Pakistan. So except to that, I mean, definitely there is a need of a training to develop the national action plan for the communities, how the communities will work, how the communities will move on. So I think I would say that Global Fund need to do something here as well, because there is a need to own the communities. Because every time we face safety and security situations in Pakistan, since that time till now, since I mean, I'm a part since 2012, since that time till now, I'm seeing the same situation. Now we have somehow the authority letters to work smoothly in Pakistan, but except to that, we have been through thick and thin. A lot of people from the law enforcement agencies usually come over, and I mean, they usually say a lot of things to us. They usually inspect a lot of things, but we are doing it at our own. communities are doing it at our own. So, I mean, there is a need to have such kind of support from the global fund, from the, I mean, this support should move on and in a better way. So, I mean, another suggestion I would say the community forum is needed for the national and international stakeholders, which will help the communities to move on in a same manner. So, I mean, so that we can say not even a single country in Asia region can be lagging behind. So, these are the suggestions from my side. Thank you, Ika.
Thank you so much, Usman. I think you make really important point around the community engagement and also integration on the work that we are doing. Chamrun, the second question, how do you identify learning gaps impact TB communities at the country level in your experience? And what specific capacity building intervention would you prioritize to strengthen the TB response in the country? Over to you,
Thank
Jim.
you so much. Thank you so much, Ika, and hello everyone. Once again, Ika and Seven Alliance for the opportunity to share some of my perspective concerning to TB response and also the report, how the report reflect the reality on the ground, especially how we better move to make sure that TB response is equitable, with a very strong focus on community and respect human rights, and as well as addressing gender for TB in particular. So just want to say that, for TB, I look at the report. So once again, saying a lot to Lisa. The report is very comprehensive and reflect the most of the reality on the ground. So I think that absolutely the report is a very good report. So saying a lot for that, and especially all the contribution that made by some of us who are here in this particular webinar. Just want to say, if you look at the report that released by the Global TB Program of WHO in 2024, there is an estimated of 10.8 million people fall ill with TB in 2023. So this is really a big number, and it up from 10.7 million in 2022 and 10.4 million in 2021. So it means that TB is really a big problem, But if you look at the funding for TB response, TB is always the last compared to the three diseases who are the causing: HIV, TB, and malaria. And if you look at the number of people die, if added up, number of people die because of HIV and malaria is equal TB. So TB is like the, what you call it, the little brother, the little sister in the three diseases, and the number of funding is always very small. And if just one more, if you look at that report again, 8 countries in our region, 8 countries account for more than 2/3 of the people who developed TB in 2023. And within our region, this includes Indonesia, China, Philippines, Bangladesh, Pakistan, Nigeria, Democratic Republic of the Congo, and India. So you see that in our region, this TB is still a big problem, and TB does need, the way that TB response need to be modified, need to be addressed. And once again, thanks a lot to Global Fund. Even though the TB, funding is still limited, but Global Fund still support the country to make the response, and especially this is, I think, for TB, if you look at from the beginning, I engage in HIV from the beginning, and I see the way that TB respond, with a strong engagement of community from the beginning is still very, very limited, very limited. So I think, but later on, because of support from other partners, including Stop TB Partnership, so the Challenge Facility for Civil Society, we see the number of movement increase, including within our region, and especially in each country, including my country. And this is the first ever that we have the real people sitting in the CCM, and they the one who really represent their community. So the capacity that required for these people who are sitting and who are representative of their constituency, we need to support them even stronger compared to the community who are especially HIV. I would say HIV from the beginning. I start HIV program in my career as a public health professional. I start in 1994, so I know the story very well. From the beginning, HIV response, we have very strong focus on community, especially through GPA concept. And GPA concept apply from the national down to community. But for TB, it's just over the past, I would say the past 5-7 years that I see some movement increase and stronger and stronger. But unfortunately, within this year, something changed again. And especially during the COVID response, you can see that the TB response also backward for 8 years. Some experts say we cannot go into NTB by 2030 because of one is COVID, and second, the recent development concerning to the funding that affect most of us, I think, in this webinar, that doing not just TB but also other health program, HIV, TB, malaria. So, but TB even worse because TB is airborne, right? It's an airborne disease, and TB has no border, and it can transmit and can infect everyone. If someone like maybe in our community like having pulmonary TB, um, they can spread the disease very quickly. The scientists confirm that they can infect 10 to 15% who are the close contact per year. So it means that if we don't have the approach or intervention that is really looking at where community engagement is stronger, I think that ending TB is really problematic. It will never work based on my experience. So the way that community engage, the way that community participate and fully engage, not just engage, but they have to be actively, engaged. This including listen to their voice, understanding their need is quite important. And the project that, including the project that Kana manage, that funded by USAID, it confirmed and documented in USAID report, saying that community engagement is very important. We implement what we call snowball approach, and snowball approach. Most of you here, I think you know very well for HIV program, but because Kana, we rooted in HIV, and then we support people who have HIV and TB, and we start doing TB. We found that snowball approach is very effective because snowball approach apply the person who experience with the disease to come on board, and they become service provider, they become lay counselor, they become supporter, and make a lot of sense. And that's why in the report documented by USAID in midterm review of the project, they asked us to adopt this model in our expansion. So looking at the the report that just mentioned by Lisa, and in response to your question, Ika, I think very important. The three things that I would suggest that the community could be the focus for community engagement. One is looking at a building moment of the community. We need to make sure that the voice of community should be louder. We need to make the voice of them louder, and that has to invest more support in terms of physical structure, making sure that these people, have enough and enough participation in a forum like advocacy, policy discussion, etc. So this need to have more increasing number. We need to make sure that this kind of building movement is one of the priority. Second thing, we need to provide ongoing support. I know that the people living with the disease or experiencing the disease, they know, what to tell their story. But very importantly is empowerment. We need to support them to build their self-esteem. We need to support them to restore their potential because they do have potential. But the way that we do things is to make sure that they can engage in acting the certain aspect from planning to project implementation and to monitoring. So the last one is the engagement on CLM because they the one who can tell exactly what is the real side effect of TB for ensuring we can have a good TB treatment, TB adherent, and what they should say, how to support people with mental health, because of TB, all of that. They know very well. So very important is to make sure a kind of investment for them to engage in CLM, and the program will have the real feedback of how the TB response should be implemented in a specific site, in a specific country. So these are the very important things. And I know that advocacy is ongoing, but again, they know what to speak, they know what to tell. But importantly, investment for them to be part of the response. Don't just say capacity building, capacity building. I think we need to make sure that they do have the stomach. They do need to support their family and they themselves. So whatever they engage, they should be compensated. They should be reimbursed because that is the engagement. And we need to pay for that and to make them stronger, more empowered, and building their self-esteem. Thank you so much, Lika.
Thank you so much, Shamron. I think you really point out the really, really important point on how we ethically engage the community on our work as well. Thank you so much. Sri Hari, last but not least speakers. How do identified learning gaps impact malaria intervention at the country level in your experience? And similar question, what the specific active capacity building intervention would you prioritize to strengthen the malaria response in the country? Over to you.
Thank you so much, Ika. Let me start with congratulating Learning Hub for this great work and also thanking Lisa for bringing all this very rich information. I think this assessment has highlighted so many things that is very relevant to malaria community, and I'm putting some malaria perspective into this. So maybe I would start with some of the key things that highlighted in Lisa's presentation. The first thing was very relevant and important was the constituency and the community engagement. And that's, I think Samrun has mentioned, but in malaria, and I see on TB also, it's very less compared to HIV and key population engagement in advocacy in terms of community engagement. Malaria is disease of very poor people, rural area, and it's been mentioned about the indigenous people and forest goers. So, bringing their voice because of where they are and then some of their status is already very challenging. And then with these circumstances, it's very difficult. So I think that was very good highlight. I see the mentioning of the indigenous people, but for malaria, sometimes the indigenous people and the forest core or those community nearby forests, they cross each other. Like if they are also indigenous people, but at the same time they are also forest core going inside the forest is spending time. So bringing their voices to different community level engagement and then growth and process is important. In terms of training, I like the CLM because the CSO platform now started very first time, I would say, in our region, Asia Pacific region, implementing CLM in malaria under the Global Fund grant. And then we already start seeing lots of challenges because government, where our CLM team is implementing C, this initiative as monitoring their performance rather than helping them to improve their services. So they are challenging why you need to do this. But I think the point here I take is either we do CLM or we use different other mechanism, how we bring community level data and then put that in a different advocacy opportunity, either that is in during the funding request development or the country dialogue or the CCM routine or regular meetings. So I think that's something important. I support personally CLM because that's, I think, the good thing to go. But since I start seeing that lots of challenge, and then in malaria, actually, the branding is something problematic now. When this monitoring word the local government see, they really scare of this word. So we are now is trying to see like how we can rebrand, but doing the same thing what CLM is guiding us. You mentioned about the constituency engagement in CCM and the Glow Fund process, and that also something I just want to echo Chamroon's point. Our community, they know they have so much story to tell, but the challenge we have is bringing that story on the table. And then for that, we need to train some of those community members who is willing to be champion to share that story. But also we need to also have some resources, the direct resources going to the community, not going to some big NGO who has lots of other operations, just giving to some small grant to community member and let them some flexibility, give them flexibility to do what helps them to be a community advocate or a storyteller. I was talking to in my last month's visit in Cambodia, one of the CCM malaria representative asking, how do you engage your community? And she said she's volunteer within the grant. So she could cover her area as part of her routine voluntary engagement, but she's missing bringing community voice to the CCM from other area where she needs some financial resources or somebody's support in coordination and providing technical support. So she will be able to bring other communities' perspective and put that in as malaria community response in the CCM. So that's something I think also good point you highlighted. I think we need to layer this in a two different level. Because we are talking about community, but we can't undermine role of civil society organization who is implementing the grant. For example, for malaria, there are country SR who engage community for their routine activity. But what's missing within this whole process is engaging community and bringing their voice systematically to those different platforms that we are talking about to improve outcome of the Global Fund funding request development up to the CCM level advocacy. I think that's one thing. So civil society capacity and use that mechanism to work with the community and build community capacity document those information. And I'm just putting malaria perspective. That might be different for other disease and other community, but that's, I think, how it works in malaria field. You also highlight about the emerging needs. And this climate, I saw some chat, some comment on chat box, but it's so relevant for malaria. And somebody joining from Pakistan will understand what does that mean to the community. Like after a big flood in Pakistan, malaria cases was spike up. There was dengue spike up, diarrhea, and so many other infectious diseases. But malaria, you see it in Pakistan, and that's just an example because of heavy rainfall and flood. Again, I visit community very frequently, and I was talking to a community member in Laos asking, what do you do in the forest? Because most of malaria is coming from the forest. And they say, well, we go there to collect some livelihood product, but we also have little farm inside the forest. And I asked them why you decided to make farm inside, and simple story that farmer told me they couldn't grow crops in the community, in the locality that they used to grow up because of the climate change and all this, I think, fertilizer effect and many things. So, and he said rainfall pattern has changed. It's not following the same pattern that used to be. So they have to find alternative option, and they are doing so many farming inside the forest. And that's he was telling the story of the climate change without knowing that, this is climate change impact. So I think that's a good point, which also I think apply to other disease also. If we see from the migration perspective, climate change also forcing people to migrate from one place to another place, and that needing for the accessing health services in an area where they migrate. But for malaria, it destroys. Malaria facility are very small. Sometimes malaria clinics are built in community volunteer or head of village house. It's just they sit there with the RDT kits to test malaria and medicine. And when there is a big flood, everything destroys, and that disrupts the services. And then again, the Pakistan and some area in Bangladesh are the great example for our region. So to your question, Eka, about the 3 priority thing that I would pick for malaria is, the first thing is community engagement, tailoring that to not for the routine activity. That's a good thing. They are volunteering, they are doing great engagement for routine activity, but community engagement, tailoring to support growth fund processes from community dialogue, country dialogue, funding request development, and the CCM, and other platform that requires community advocacy. Capacity building. I think we need some community small grant that goes to community directly and help them to build their capacity, train them how to speak in the CCM meeting, how to organize the information, the story they have. It's a small thing, but they need that. And I think the third one, with linking with the CLM and or any mechanism that is helping us to bring community level data. We need more training on data collection also, but also the advocacy. Like this small group of community, they work in CLM, they bring more than malaria related data to the CLM. Sometimes the community, they cover malaria, but they also look into what are the other social issues that is disturbing access to health services or communities' livelihood or lifestyle. And then those can go into other opportunities that community apply. I'm here in Thailand, and I share the experience in Thailand. The local authority, local administrative authority, they have different funding opportunity for the community where they can group of community without any legal registration or anything. They can prepare proposal for health response, including malaria or TB or HIV, depending on their prioritization. And they can apply for that local grant and use that grant for their community response. And there might be some other private sector and other. So it's a thinking from now, moving out of the donor fund also, because funding is now, we see this funding scenario is changing, and then this recent US decision is impacting so much community. So, but we also need to be resilient. We can't stop with this problem. We have to advocate for that. But we also need to find a way how we can start mitigating that and continue work we are doing. And I think this is something Seven Alliance and this learning hub can help building community capacity in terms of their engagement, their advocacy, and then be self-reliant for looking other opportunities. I will stop here, and thanks for the opportunity.
Thank you so much, Srihari. I think among the 3 panelists, we are agreed that community engagement need to be strengthened, and also the capacity for the community to engage more in the Global Fund process, and how we as the Seven Alliance supporting the communities throughout the process, right? So now I'll take a look on the question and also comment on the chat box. So we have from Sonal Mehta, the few points, the community participation in CCM, it showed the presence but not engagement. And also there's issue of community are many and why we are bringing climate change. And also Sonal has appreciate the effort greatly from the yeah, Lisa and also Seven Alliance. The next comment is from Al Hassan Nuhu. The HIV is increasing globally currently, and this is need immediate public health intervention. How do Seven Alliance involve us in the implementation to curb this situation, especially those in Ghana? I think I would like to have the comment on this one, since the Seven Alliance is more focusing on the Asia Pacific region, but the other learning hub they also have in Africa region. Please contact Chinmay so you will get more information and connect you with them. The other one is, as far as ASEAN CLM concerned, Pakistan plays an important role in the region, and Pakistan should be part of the alliance and learn to contribute. As Seven Alliance, of course, we will do our best to include all of the country in the ASEAN Pacific. So please bear in mind that we will include Pakistan and other country to get more engagement on our work. So what from Francis, what are the feedback mechanism of community issue within the CCM? What system are followed and how effective and transparent is it? Thank you so much, Francis, for the question. I understand that there are many important issue at the CCM. So however, today's discussion is will be focusing on the survey result and how we can use them to strengthen the community. So we apologize that we are unable to address your question this time, but next time, if we have more discussion on the CCM, we will get back to you on this one. What else? I think that's it from the chat box. If anyone have any other burning question or comment, please feel free. Otherwise, I will give the floor back to Karon.
Thank you so much, Ika. Let me turn on my camera. Thank you so much, Ika, for facilitating this session. Now, for the next session, I would like to call Chinmay Kumar, Program Coordinator of Asia Pacific Regional Learning Hub, to take us through the plan of Asia Pacific Regional Learning Hub for 2025 to address the LNA result this year. Chinmay, over to you.
Thank you so much, Karen. First of all, thank you so much to all the panelists as well as participants for having the discussion about the Learning Needs Assessment Survey. Of course, like we have captured very important points in terms of what are the priorities and what are our communities looking forward to in terms of building their capacities as well as the global fund priorities in the country. Now, like, for the Asia Pacific Regional Learning Hub, we have some sets of components where we will be able to address the priorities which are identified through the survey. Usually, like, virtual learning sessions are some of the webinars where we, sorry, the PPTs, can you please reshare?
Yes.
Yeah, thank you. Yeah, so virtual learning sessions are one of the mechanism where we make sure that, like, all these priorities as well as important topics which are highlighted by the communities in the survey will be taken care of in terms of sharing the learning points for the communities. For this year, like, we will be organizing one webinar every quarter. That means we will be having 4 webinars for this year 2025 to making sure, like, some of these priorities are answered for the communities. And, like, if I can just give you a brief background of what type of webinars or virtual learning sessions we are going to organize. So it's something like, strengthening community engagement in grant implementation and oversight. Also, what are the innovative and effective examples of young people or youth organizations towards sustainability? What are the CLM experiences for from the ground? What are the, like, CLM data used to influence service improvements? or recommendations on CLM. So like, these are some of the topics. Like we also have GC8 preparations coming on. So like, we are very much excited to also organize a webinar for our communities in the second half of the year. And also like, not just webinars, but we also will make sure like, the information which can be addressed through the newsletters. Will try to write a precise newsletter where communities can read our newsletter, and they can get support from these newsletters and build their capacities. Um, we are releasing one newsletter tomorrow, which is on Global Fund short-term technical assistance. A lot of our country partners, we reach out to them to explain them about what is Global Fund short-term technical assistance. A lot of our community partners are not aware of it. If you want, the details are mentioned in the Seven Alliance website. If you go to the Learning Hub page, you will see the information related to Global Fund short-term technical assistance, or you can reach out to me directly, write an email to us, and then we can have a call to explain you more about what is Global Fund short-term technical assistance. So like these are some of the important um, activities which we will be planning. Um, and like for Global Fund short-term technical assistance, last year we had Sri Lanka, we had Thailand, we had Nepal who applied for it, and like they are right now implementing the TA project in the country. Then we also have small grants to support country level engagement. The call of I mean the request for proposal right now, it's open. The deadline to apply for small grants is 9th March. You can again visit our website, and all the details are mentioned over there regarding small grants for country level engagement. If you have any questions, you can also reach out asking questions regarding small grants, and we can respond to that. Then we will also be working on publishing case studies to highlight best practices related to community engagement in the country, where other countries can also replicate um, best practices to make sure like community engagement are well encouraged, and not just showing their presence, but they are meaningfully engaged in the country. Then we have like podcast, because if we see the learning needs assessment survey results, there is a lot of things which cannot be either included into newsletters, which cannot be either included into the webinars. So just to make sure, apart from what our work plan is, we are also going to publish small 10 minutes kind of a podcast, which will be informative to topics related to, for example, CCM, related to funding request, like anything related to global fund processes, which can build capacity of communities if they just go through this. Again, like giving a lengthy video is sometimes tiring, so we will make sure that the podcasts are very precise and small, that it's easy for our viewers, or it's easy for our communities to also collect information from such podcast. Apart from that, we also have community participation support, which are like we try to encourage communities who can be part of such conferences. Like we can support their participation, though the budget is very limited. It's like we cannot support the huge number of communities, but like if there is any kind of engagement happening and they want support in terms of engagement, then like Learning Hub can support over there as well. And then this one of the activity related to Grand Cycle 8. It's an in-person meeting, and we are very much excited to host the in-person meeting, which will be during the second half of the year. So these are some of the engagement where we will try that all the learning needs assessment findings are somehow accommodated into our work plan, and this is how we will be able to respond to the communities in terms of building capacities related to global fund processes. Uh, Next slide, please. Yeah. So this is a request for proposals. Just mentioned that I just mentioned that the request for proposal is right now open. Small grants are of are up to $6,000, and you can just scan the barcode, or like you can directly reach out to our website and get the details from it. Next slide. Yeah, that's it. Thank you so much for listening.
Thank you so much, Chinmay, for your presentation and our plans for 2025. Now we are at the end of the webinar. So for the closing remarks, I would like to call on Annabelle Metzer. She is a technical advisor at Community Engagement CRG Department in Global Fund. And at the same time, we are sharing the Mentimeter links and QR code for the webinar feedback in the chat box. I would like to request to you all participants to participate on it while listening to Annabelle. Annabelle, over to you. Thank you.
Thank you so much, Karen. And I just also want to start and thank the Learning Hub really for leading this important study, and acknowledge Lisa and really everyone who shared their insights during the process. It was super exciting to see the results today again. I just also wanted to reflect quickly a little bit on the context we're in while we're looking at these results, and acknowledge that we're really seeing very rapid shifts in global priorities, and coupled with really historic cuts in terms of funding and restructuring of funding for HIV, TB, and malaria. So I think while the survey and the results are more relevant than ever, we also have to make sure that we contextualize the results and prioritize. And thanks to the speakers today who also have already started to help us doing that. Because while I think the needs are so important and continue to be relevant and have not changed in the last month since the study, the resources to respond to them are quite tight, and we need to make the best out of the resources that we currently have at hand. So I want to speak a little bit more to some of the opportunities that I'm seeing, and Chinmay has already outlined many of those. I think the short-term technical assistance for us at the Community Engagement Strategic Initiative is really a key avenue to support communities to engage in Global Fund, but also related processes like national strategic planning or development of other national strategies. And over the years, we have really tried to build in a component around, we call it Global Fund 101, or really the basics around understanding the Global Fund and understanding the grant in your country. So we will continue doing that, and the learning hubs also try to build in some of this basic knowledge wherever, because we also want to make sure that we're really reaching new people who may not yet be fully aware about Global Fund processes. I'll also put in the chat in a moment the link to the Community Engagement Toolbox. That's a toolbox that we have put together over the years to really capture a lot of resources out there that were developed by global and regional key population, TB and malaria networks. And I just invite you to look through that to see if you find any relevant resources for you. And we will also revise this toolbox this year. So there will be some new resources included, like for instance, around how to engage in grant revisions, Global Fund grant revisions. Chinmay has really spoken to the work of the Learning Hub. I think the results can really help to tailor the work, and I just want to encourage you to take up some of the opportunities like the small grants, the webinars, and so on. And lastly, I also just want to acknowledge a little bit where we are at as the Global Fund currently in the grant cycle. As many of you will be aware, we are in a replenishment year, and therefore we don't have a lot of certainty about how the funding for the next grant cycle, GC8, will look like. But throughout the year, we will have much more certainty around the level of funding for the Global Fund, around the technical guidance, around what is eligible for GC8, and it will be becoming much clearer. So our team will also work on, packaging all the technical guidance related to communities, human rights, and gender responsive programming in a way that it's really digestible, because we know that these resources can also be quite heavy. And before we close the webinar, I just also wanted to respond to some of the questions and comments that I have seen in the chat. I think some of the topics, and I think Sri, you were saying the climate change, how relevant is directly for malaria, and how you're seeing the direct and indirect impacts there. I think we can definitely also, through Chinmay, link you up with some of the learning hubs in other regions, because we support learning hubs in 6 regions. And some of the activists there working, for instance, on climate adaptation, or other of the more emerging topics that came out of the survey. So if you want to be connected to advocates in other regions, please reach out to Chinmay, and we will be able to make the relevant links for you. And lastly, there were some, I saw that CLM came out really as a big topic, an important topic in the assessment and also in the chat. So I want to speak to 2 webinars that are coming up in the next month. So one webinar in March will focus on community engagement in Global Fund grant implementation oversight. So I hope it will speak a little bit to your question, Francis, also around what are feedback mechanisms, how can communities participate more effectively in decisions in the oversight committee. And the second one will be around community-led monitoring around May, probably, which will also be a global webinar where we'll hear also experience from other regions. So with these final remarks, I just want to thank everyone again for the excellent contributions today, and especially also to Usman, Chamran, and Sri for bringing some more nuance to the study results that we have seen. And over to you, Karen, for the final remarks on the survey.
Thank you so much, Annabelle, for this. Before we close this webinar, I would like to thank everyone for sharing the comprehensive information around the learning need assessment, and also sharing and highlighting the community engagement, and also the global situation of the global fund process in the country level. I would like to also request everyone to please participate for the Mentimeter, and that's it from my end. Thank you so much, all the panel speakers, interpreters, Yashvinder, for a comprehensive information that you have collected and consolidated. And over to you, Chinmay. Thank you.
Thank you, Karen. I would just want to check how many response we received in terms of on Mentimeter for our feedback. If we have less responses, I'll request everyone to please scan the Mentimeter QR code and response. If you have any specific question, or you want to hear more regarding what type of webinars or any kind of feedback, then please respond to it, and it will be great for us to also take note of that. Thank you.
Thank you so much, everyone. See you in the next virtual learning session, and also in the middle for any kind of community engagement. Thank you so much.
Thank you.
Thank you. Thank you all.
And all. Bye-bye.
Thank you, everyone. Bye-bye.
Bye.